societal, cultural, and school factors most impact the over and under identification for special education? As a group of special education teachers and an MTSS coordinator, our job relies on the correct identification of students receiving special education services. With so many factors to consider, how can we ensure students are being neither over nor under identified for services? This presentation examines this question and considers 4 factors: categories of special education, demographic influences, parental influences and perceptions, and the response to intervention and evaluation processes.
Students with ASD diagnosis often receive early interventions for behavior, language, and skill acquisition. Students with severe behaviors are often referred to special education at a higher rate than students who only have learning disabilities. White students had the highest probability of qualifying in any disability category. However, students in the Latino community, particularly with ASD diagnosis, had a lower rate of referral to this category.
In our literature review, we found 5 resources related to SES. We found 8 related to race and 9 related to language, and how those 3 things, SES, race, and language, impact over and under identification in special ed. There's some conflicting studies say that sometimes there's over-representation and sometimes there's under, so it's important to look at how those factors influence each other and the intersectionality of them.
According to the literature relating to parental perceptions and influence, 3 studies reported on family perceptions. Their interviews mentioned little knowledge of the IEP process, limited placement choices, lack of communication, and the IEP process not explained in their native language. 2 additional studies mentioned the positive effects of parental involvement. For example, Ansberry and Abel reported programs that included evidence-based practices with coaching from the staff and empowered families to take more active roles in the IEP process.
According to the literature relating to the RTI and evaluation processes, 2 studies mention the lack of policies, procedures, and guidance around the RTI and MTSS process impacting special education identification. For example, Hudson and McKenzie state lengthy RTI requirements may lead to the under-identification of students in a timely manner. And 3 studies mention the lack of attention and policies around the needs of linguistically diverse students can lead to over-identification of students based on language needs and the lack of differentiation between language acquisition and disability. From our compilation of articles, we identified one outlier. The article from Sprick, Bach, Berg, and Coughlin discuss how attendance influences students' access to the RTI process and special education services, but it does not specifically correlate to issues in special education identification.
This information is applicable to our own practice because it encourages us to look for evidence-based practices when working with diverse students, especially those that are emerging bilinguals, and we need more consistent policies and guidelines at our schools and our districts and our states that we can advocate for. It also encourages us to be aware of our own implicit biases that may lead to over or under representation, and encourages us to work more with families to support them.
Parent involvement is necessary, particularly with students with autism spectrum disorder. Teachers should work together with interventionists to ensure that parents understand the disability category and help parents to identify the proper pathway for identification and support. Researchers should also focus on exploring the relationship between interventions within the school environment and identification of the disability in the MTSS process to avoid overrepresentation in all categories.
Teachers and schools need to familiarize themselves in their district's policies and procedures of RTI and how to execute the steps effectively and efficiently. But more importantly, be diligent in overseeing the process and advocating for your students so that no students become lost in the RTI process. There's also a need to better differentiate between language acquisition and learning disabilities when evaluating and providing interventions, so to not over-identify students based on their language needs. This means we must include language experts such as ESOL teachers and speech and language pathologists in our discussions about emergent bilinguals. Their expertise and insight can help determine students' specific language needs.
Properly involving parents in the IEP process is crucial for several reasons, as it directly impacts the effectiveness of the IEP, including appropriate diagnosis and placement and the overall success of the student's education. As you can see, there is a need to fully involve parents in the special education process. School districts, programs, and teachers should use a variety of approaches, which may include routines-based interviews to facilitate discussions and cultural advocates to help parents navigate and clearly understand.
RTI and MTSS must not be used to deny students access to special education evaluation. It's vital to provide clear policies and training to staff on the correct ways to follow this process. This information should include procedures, expectations, timelines, and address the needs of culturally and linguistically diverse students. Failing to do so can lead to under-identification in students due to the lack of knowledge and understanding how, or over-identification of students based on skewed information regarding language acquisition versus poor evaluation results.
To ensure meaningful parental involvement and appropriate diagnosis and placement, schools should communicate regularly with parents, provide information in a language they understand, and consider any cultural or accessibility barriers that may exist. Schools should respect the value of parents' contributions, fostering a collaborative and respectful partnership throughout the IEP process.
Another big takeaway from our research was that it is important to look at the intersectionality of how race, SES or class, and language impact special education referral and eligibility, and to look for more clear guidelines, policies, and practices when working with diverse students.
Effective collaboration between parents and teachers is essential to implement targeted behavioral strategies and provide timely interventions, thereby minimizing the need for excessive referrals to special education.